Hello everyone, myself Om Khandare. I am student of Dr. Ullas Patil Medical College, Jalgaon. So we are going to discuss about anti-anginal drugs. So let's start. What is angina pectoris? Angina pectoris refers to strangling or pressure-like pain caused by cardiac ischemia. The pain is usually located substernally, but it is sometimes perceived in the neck, shoulder, arm, or epigastrium. There are three types of angina. First one is atherosclerotic angina. Attacks are predictably provoked by exercise, emotion, eating, or coitus and subside when the increased energy demand is withdrawn. Rest by reducing cardiac work usually leads to complete relief of the pain within 15 minutes. Atherosclerotic angina constitute about 90% of anginal cases. Second one is vasospastic angina. Attacks occur at rest or during sleep and are unpredictable. Vasospastic angina is responsible for less than 10% of anginal cases. The last one is unstable angina. It is characterized by the increased frequency and severity of the attacks that results from a combination of the atherosclerotic plaques, plate aggregation of fractured plaques, and vasospasm. Classification of anti-anginal drugs. The first one is nitrates. Short-acting nitrates are glyceryl trinitrate. Long-actings are isosorbide dinitrate, isosorbide mononitrate, etc. Second one is beta blockers. Propranolol, metoprolol, atenolol are some beta blockers. Third one is the calcium channel blockers. Phenylalkylamine, verapamil, benzodiazepines, ditilzamine, dihydropyridines are nifedipine. The fourth one is the potassium channel openers, nicorandil. So nitrates or organonitrates, the mechanism of action or the is preload reduction, the peripheral pooling of blood, decrease venous return. After load reduction, nitrate also produce some arterial dilation, slightly decrease total peripheral resistance of after load on heart. Redistribution of coronary flow. In the arterial tree, the nitrates preferentially relax bigger conduction coronary arteries than arterioles or resistance vessels. Mechanism of action. The organic nitrous agents are products that source of NO, that is nitrogen oxide. The nitrogen oxide activates the soluble isoform of guanyl cyclase, thereby increasing intracellular level of cyclic GMP. In turn, the cyclic GMP promotes the dephosphorylation of the myosin light chain and the reduction of cytosolic calcium and leads to the relaxation of smooth muscle cells in a broad range of tissues. Pharmacokinetics. The organic nitrates are lipid soluble, well absorbed from buccal mucosa, intestine, and skin. Ingested orally, all except isosorbide mononitrate undergoes extensive and variable first-pass metabolism in liver. They are rapidly denatured by a glutathione reductase and a mitochondrial aldehyde dehydrogenase. Adverse effect. The headache is the most common adverse effect of nitrates. High doses of nitrates can also cause postural hypotension, facial flushing, and tachycardia. Phosphodiesterase type 5 inhibitors such as sildenafil potentiate the action of the nitrates, preclude the dangerous hypotension that occurs. These combinations contradicted. Tolerance. Tolerance is the action of nitrate develops rapidly as the blood vessel become desensitized or to vasodilation. Tolerance can be overcome by providing a daily nitrate-free interval to restore sensitivity to the drugs. Dependency. Sudden withdrawal after prolonged exposure has resulted in spasm of coronary and peripheral blood vessel. Withdrawal of nitrate should be gradual. Uses. Angina pectoris. The GTN produces relief within 3 minutes in 75% patients. The rest may require another dose or take longer. Acute coronary syndrome. Nitrates are useful by decreasing preload as well as by increasing coronary flow. Myocardial infarction. GTN is a frequently used drug involving myocardia with the aim of relieving chest pain, pulmonary congestion, and limiting the area of necrosis by favorably altering the oxygen balance in the marginal partial ischemic areas. Uses. CHF and acute LVF. Nitrate affordable relief by venous pooling of blood reduces venous return, decrease end diastolic volume, improvement in the left ventricular function, biliary colic, esophageal spasm, cyanide poisoning. Nitrates generates methemoglobin, which has highly affinity for the cyanide radical and forms cyanamethanoglobin. Beta blockers. The beta adrenergic blocker decrease the oxygen demand of the myocardium by blocking beta receptors, resulting in the decreased heart rate, contractility, cardiac output, and blood pressure. All beta blockers are nearly equally effective in decreasing frequency severity of attack, and an increase in exercise tolerance in classic angina. But cardioselective agents are preferred non-selective beta 1 and beta 2 blockers. Agents with intrinsic symptomatic activity, such as pindolol, should be avoided in patients with angina and those who have bad or who had a myocardia. The MCQs: which class of antiangial drug primarily work by dilation of blood vessels to increase the blood flow to the heart? The answer is first, nitrate. Second MCQ: the nitroglycerin is commonly used to use a nitrate medication for angina. How is usually administered? The answer is sublingual tablets or spray. Third one, the beta blockers are used in management of angina by. The answer is reducing heart rate and blood pressure. The fourth one is, what is the primary mechanism of action of beta blockers in the treatment of angina? Option is C, reducing heart rate and myocardial oxygen consumption. The last MCQ, which of the following is a common side effect associated with nitrate medication? Is C, headache. So thank you everyone.